Cna Practice Test Alabama. Question 1. A resident has a doctor's order for up with help of 1 UWH1. What does this mean? Option A. The resident is independent with mobility. Option B. The resident requires the assistance of one person to get up. Option C. The resident is bedridden and cannot get up. Option D. The resident needs a mechanical lift for transfers. The correct answer is option B. The resident requires the assistance of one person to get up. UWH1 is an abbreviation meaning the resident requires the assistance of one person to get up from bed or a chair. This is a transfer assistance level. The aide should follow the care plan and use proper body mechanics. Question 2. Which of the following is the most important reason for reporting changes in a resident's condition to the nurse? Option A. To document the change in the aide's daily notes. Option B. To protect the facility from liability. Option C. To prevent deterioration and provide timely intervention. Option D. To demonstrate that the aide is performing their duties. The correct answer is option C. To prevent deterioration and provide timely intervention. Early detection and reporting of changes, skin breakdown, behavior changes, decreased appetite, allows for rapid intervention and prevents further deterioration. Resident safety and well-being is the highest priority. Question 3. The licensed practical nurse assists the registered nurse in preparing a continuous intravenous 4 infusion for a dehydrated client. Which priority item should be checked before initiating the 4 infusion? Option A. Baseline body weight. Option B. Intake and output record. Option C. Serum electrolyte levels. Option D. The client's dominant side. The correct answer is option A. Baseline body weight. Baseline body weight is the priority because it is the most sensitive and specific indicator of fluid volume status when compared daily. Weight changes directly reflect fluid gains or losses. Question 4. How should the nurse handle soiled linens with feces to prevent infection spread? Option A. Shake outside the room. Option B. Place directly in the laundry chute. Option C. Place in a pillowcase and deposit in the dirty linen hamper. Option D. Rinse at the sink. The correct answer is option C. Place in a pillowcase and deposit in the dirty linen hamper. Containing soiled linens in a pillowcase or hamper prevents contamination of the environment and healthcare workers. Shaking and rinsing spread infectious particles and are strictly prohibited. Question 5. When measuring a resident's respiration rate, when is the best time to do this? Option A. Immediately after measuring the pulse. Option B. While the resident is talking. Option C. After the resident has been exercising. Option D. When the resident is unaware that breathing is being counted. The correct answer is option D. When the resident is unaware that breathing is being counted. Respirations should be counted when the resident is unaware, as people often alter their breathing pattern, consciously or unconsciously, when they know they are being observed. Counting immediately after taking the pulse while still holding the wrist is an effective technique. Question 6. The practical nurse is adding tap water to several medications for administration via feeding tube. Which preparation should the nurse administer without delay? Option A. Reconstituted powder. Option B. Timed release capsule. Option C. Cherry-flavored elixir. Option D. Flavorless suspension. The correct answer is option A. Reconstituted powder. Reconstituted antibiotics and other unstable medications must be administered promptly after mixing to maintain potency. Timed release capsules should generally not be crushed or given via feeding tube unless specifically formulated. Question 7. Which client statement indicates a need for assistance with bathing? Option A. I don't understand why I'm so weak and tired. Option B. I prefer to bathe myself but need encouragement. Option C. I can dress myself but need help with washing my back. Option D. I enjoy bathing independently. The correct answer is option A. I don't understand why I'm so weak and tired. Expressing weakness and fatigue indicates a functional limitation that may affect the ability to bathe safely. The client may need assistance or supervision to prevent falls or exhaustion. Question 8. A resident refuses to take a prescribed medication. The nurse aide should Option A, crush the medication and hide it in applesauce. Option B, tell the resident they have no choice but to take it. Option C, respect the refusal, report it to the nurse, and document it. Option D, leave the medication at the bedside for later consumption. The correct answer is option C, respect the refusal, report it to the nurse, and document it. Residents have the legal right to refuse medication. The nurse aide must respect the refusal, immediately report it to the supervising nurse, and document the refusal in the medical record. Coercion or deception is unethical and illegal. Question 9. The nurse aide is caring for a resident who has a stage 3 pressure ulcer on the coccyx. Which positioning aid is most appropriate? Option A doormat cushion. Option B, a rolled towel placed under the coccyx. Option C, a gel mattress overlay. Option D, a foam wedge under the knees. The correct answer is option C, a gel mattress overlay. Pressure redistribution surfaces like gel or foam mattress overlays reduce pressure on bony prominences. Doormat cushions are no longer recommended. They cause venous pooling and pressure at the doormat edges. Wedges under knees can be used but don't directly relieve sacral pressure. Question 10. A resident has a new onset of slurred speech and weakness on the right side. The nurse aide should: Option A, help the resident walk to the bathroom. Option B, give the resident a drink of water. Option C, recognize these as signs of stroke and call for help immediately. Option D, document the findings and monitor for changes. The correct answer is option C, recognize these as signs of stroke and call for help immediately. Sudden onset of slurred speech and unilateral weakness are classic signs of stroke: fast, face drooping, arm weakness, speech difficulty, time to call. This is a medical emergency requiring immediate intervention. Question 11. A client with gastroenteritis, nausea, and vomiting is on NPO status. The healthcare provider prescribes oral intake to advance as tolerated. Which fluid should the nurse offer first? Option A, tea. Option B, broth. Option C, water. Option D, soda. The correct answer is option C, water. Water is the least irritating and most easily tolerated fluid. Clear liquids should be introduced slowly, beginning with small sips of water, progressing to broth, tea, and other fluids occurs only if water is tolerated. Question 12. A client has rectal cancer and is scheduled for an abdominoperineal resection. What should be the priority nursing care during the postoperative period? Option A, teaching how to irrigate the ileostomy. Option B, stopping electrolyte loss in the incisional area. Option C, encouraging a high-fiber diet. Option D, facilitating perineal wound drainage. The correct answer is option D, facilitating perineal wound drainage. The perineal incision will have drains to facilitate wound drainage and prevent infection. Promoting drainage is the priority. The client will have a colostomy, not ileostomy. Question 13. A resident who is lying on her back, supine, begins to choke on food. The nurse aide's first action should be to: Option A, perform abdominal thrusts immediately. Option B, turn the resident onto her side facing the aide. Option C, call 911 before providing care. Option D, sweep the mouth with a finger to remove the obstruction. The correct answer is option B, turn the resident onto her side facing the aide. The first step is to turn the resident onto her side, lateral position, to allow gravity to help dislodge the obstruction and prevent aspiration. Abdominal thrusts are used only if the resident cannot cough, speak, or breathe. Finger sweeps are only performed if the obstruction is visible. Question 14. A resident who is confused begins to hit and scratch the nurse aide during care. What should the aide do? Option A, finish the care quickly while ignoring the behavior. Option B, restrain the resident's hands to prevent further injury. Option C, step back, stop the procedure, and reapproach later or get help. Option D, hit the resident back in self-defense. The correct answer is option C, step back, stop the procedure, and reapproach later or get help. The aide should stop the procedure, step back to a safe distance, and reapproach later with a different strategy or additional staff. Continuing care could escalate the behavior. Restraints require orders. Never strike a resident. Question 15. A resident with a history of falls is getting out of bed without assistance. What should the nurse aide do first? Option A. Apply a vest restraint to prevent further attempts. Option B. Remind the resident to call for help and offer assistance. Option C. Report the incident to the charge nurse immediately. Option D. Lower all 4 side rails to prevent injury from climbing over. The correct answer is option B. Remind the resident to call for help and offer assistance. The least restrictive intervention should be attempted first. Reminding the resident to call for help and offering assistance respects the resident's rights while promoting safety. Restraints require a doctor's order and are a last resort. Question 16. The nurse is making initial rounds on a client with a C5 fracture and Crutchfield TOMS. Which equipment should be kept at the bedside? Option A pair of forceps. Option B, a torque wrench. Option C, a pair of wire cutters. Option D, a screwdriver. The correct answer is option B, a torque wrench. A torque wrench is kept at the bedside to tighten and loosen the screws of Crutchfield TOMS. It controls the amount of pressure applied to the screws and is essential in an emergency to remove the traction apparatus. Question 17. A male Native American client with tuberculosis keeps his eyes on the floor and does not make eye contact. How should the nurse interpret this behavior? Option A. He is uncomfortable with violation of his personal space. Option B. The client is depressed and concerned about his diagnosis. Option C. His culture finds sustained eye contact rude and disrespectful. Option D. The client is reluctant to speak without a tribal shaman present. The correct answer is option C. His culture finds sustained eye contact rude and disrespectful. In many Native American cultures, sustained direct eye contact is considered disrespectful, especially when speaking with someone of higher status or different gender. The nurse should respect this cultural norm. Question 18. A resident with dementia repeatedly asks what time is dinner even after being told. What is the best response? Option A. I already told you. Dinner is at 5 o'clock. Stop asking. Option B. Ignore the question since it has already been answered. Option C. Calmly repeat the answer each time the question is asked. Option D. Show the resident a clock and teach them to read time. The correct answer is option C. Calmly repeat the answer each time the question is asked. Residents with dementia often have short-term memory loss. The most therapeutic approach is to answer calmly and consistently each time. This reduces anxiety and frustration. Teaching new skills or expressing irritation is not appropriate. Question 19. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? Option A. Starting and fall. Option B. Applying oxygen. Option C. Obtaining blood gases. Option D. Medicating the patient for pain. The correct answer is option B. Applying oxygen. Burns to the face and neck compromise the airway due to potential inhalation injury and edema. Applying oxygen is the priority. For access and pain, medication follow after airway is secured. Question 20. Which position is best for the nurse to place the client during administration of a rectal suppository for constipation? Option A. Prone with pillows under the abdomen. Option B. Supine with the client on a bedpan. Option C. Left sims with the upper leg flexed. Option D. Right side lying, knee chest position. The correct answer is option C. Left sims with the upper leg flexed. Left sims position, left side lying with right knee flexed, allows the suppository to be inserted along the natural curve of the rectum and promotes retention by gravity, as the sigmoid colon is on the left side. Question 21. When providing foot care to a resident with diabetes, the nurse aide should not. Option A. Dry thoroughly between the toes. Option B. Report any redness or open sores. Option C. Soak the feet in warm water. Option D. Apply lotion to dry areas, avoiding between toes. The correct answer is option C. Soak the feet in warm water. Diabetic residents should not soak their feet because soaking can dry out skin, increase infection risk, and lead to skin breakdown. Feet should be washed gently with mild soap and warm water, then dried thoroughly. Question 22. When helping a resident who has right-sided weakness to put on a shirt, the nurse aide should: Option A, put the right, weak, arm in first, then the left, strong, arm. Option B, put the left, strong, arm in first, then the right, weak, arm. Option C, allow the resident to dress independently without assistance. Option D, use only button-down shirts for ease of dressing. The correct answer is option A, put the right, weak, arm in first, then the left, strong, arm. Dressing begins with the weak or affected side first, then the strong side. This makes the process easier and less painful. When undressing, remove the strong side first, then the weak side. Question 23. A resident has an indwelling urinary catheter. When providing perineal care, the nurse aide should: Option A, clean away from the meatus, down the catheter tubing. Option B, clean toward the meatus, from tubing toward the urethra. Option C, leave the catheter alone since it is sterile. Option D, apply powder around the insertion site. The correct answer is option A, clean away from the meatus, down the catheter tubing. Perineal care for a catheterized resident involves cleaning away from the meatus, down the catheter tubing, to prevent introducing bacteria into the urethra. The catheter should be held at the insertion point during cleaning to prevent tension. Question 24. A resident has a stage 2 pressure ulcer on the sacrum. When positioning the resident, the nurse aide should: Option A, position the resident flat on the back to relieve pressure. Option B, keep the resident in a side-lying position with a pillow between the knees. Option C, avoid turning the resident to prevent disturbing the wound. Option D, use a doormat-shaped cushion to float the sacrum. The correct answer is option B, keep the resident in a side-lying position with a pillow between the knees. Side-lying position relieves pressure on the sacrum. Pillows between the knees prevent pressure on bony prominences. Doormat cushions are no longer recommended as they can cause venous pooling and worsen tissue damage. Regular repositioning is essential. Question 25. The nurse is caring for a client with laryngeal cancer. Which finding ascertained in the health history would not be common for this diagnosis? Option A, foul breath. Option B, dysphagia. Option C, diarrhea. Option D, chronic hiccups. The correct answer is option C, diarrhea. Diarrhea is not associated with laryngeal cancer. Common findings include foul breath, from necrotic tumor, dysphagia, difficulty swallowing, and chronic hiccups, from phrenic nerve or diaphragmatic irritation.